Welcome to our celebration. Good morning to you. My name is Jody Latina. I'm the Associate Vice President for Communications and Media here at Central. We thank you for joining us for our celebration today. And without further ado, I will introduce Dr. Zulma Toro. She is our first female president and Hispanic Chief Executive Officer in our entire history, 175 years.
Good morning. It is a real pleasure to stand before you as we gather to celebrate an innovative addition to our university. It's the first time I am going to make it public where the motivation for this initiative came from. My conversations with the mayor and my conversations with our most important donor, Carol Ammons. They motivated us to look into the possibility of having what we are celebrating today as an innovative addition to our university. Today, we officially cut the ribbon on the Central Community Health Education Clinic, a cornerstone of the College of Health and Rehabilitation Sciences, a new addition as well. As you know, the clinic has been operational for a number of months, and it has been very moving to see how much our community has embraced it. That makes me more certain than ever that as we fulfill our community engagement goals, we'll make the world a better place, starting right here. The College of Health and Rehabilitation Sciences will amplify this work. Students across several disciplines become highly skilled healthcare professionals who are compassionate advocates for healthcare access and best practices in the field of allied health. Through interdisciplinary collaborations, we will pave the way for stronger community partnerships and better health outcomes. We recognize that health is not just the absence of illness. It is a holistic concept that encompasses physical, mental, and social well-being. From there, we'll create programs that are responsive and meaningful to our neighbors. This clinic and the new college also underscore Central's commitment to apply learning opportunities for our students. The hands-on experiences they will gain here will ensure they excel in their careers and address critical healthcare needs in our region. I would like to take a moment to express my gratitude to everyone who has been involved in making this vision a reality. This has been a real team effort. I would like to recognize our provost, Kim Costellos. And let me say, when the provost and I started having this conversation, she was not provost, she was dean. I don't know if you remember. And she kind of looked at me like I was a little bit crazy, but she immediately said, we are going to do exactly what the University of Delaware has. Do you remember that conversation? So, Provost Costellos, thank you for being a champion of a crazy idea. To the nursing program leadership team, you have been awesome. Thank you for your guidance. Thank you for your hard work. Thank you for leading us in this important endeavor. Also, to the Clinic Faculty Advisory Board, again, a group of faculty who has embraced this innovative idea. To all of you, thank you. Thank you for responding to the needs of our community, but also to the needs of our students. And if you have not met her yet, make sure to say hello to the new dean of the college, Dr. J. That's the way I like to call her, okay? She has my full support. She is full of energy And I look forward to watching the college thrive under your direction. As we cut this ribbon today, let us celebrate not only the official opening of this new health education clinic and college, but also the countless opportunities that lie ahead. We are not just building a facility, we are building a future where healthcare is within reach for those who need it most. Together, we will foster a culture of collaboration, innovation, and compassion that will resonate through our community. And that work together includes the city and the mayor. Thank you. Thank you for being here.
And now it's my pleasure to introduce our Honorable Mayor of New Britain, Aaron Stewart, who is also a Board of Regent here in the state of Connecticut and an alum.
The most important part is the CCSU alumni piece, first and foremost. Then I get to be here as mayor, then as a regent, but don't tell anybody from the Board of Regents I said that. Good morning. It's really an honor, and thank you so much for having me here to offer a few words this morning about how important this community health education clinic is going to be to the city of New Britain, to the community that CCSU is serving with the work that you will do here. I just have to say a few things about meeting the needs of the community that you're representing or the community that you sit in. And I have to say I'm so appreciative for Dr. Toro for taking what I said and figuring out how to build around that. This is, our community is incredibly diverse, and meeting the needs, especially for the healthcare outcomes of people in our community who need it and need it the most, is going to do wonders. It's not only going to do wonders for the students that are learning here and building on that, but it's going to do great things for our community, for people who need it as well. As mayor, I'm incredibly grateful to have that. And then I walk in and I learn that you're already planning for expansion, so that means pretty damn good so far. Great, congratulations. That's wonderful news. But then, if I put my Board of Regents hat on for a moment too, it does make me proud to know that our universities and our systems, the best one in CCSU, I can say that, are responding to the needs of those that they are serving and looking at the bigger picture of how our universities and our institutions can impact our greater communities across the state of Connecticut, not just live in their little bubble of the universities and just the campus itself. That means a lot. It means a lot to the people of New Britain. It means a lot to the different partnerships that we'll be able to forge because of this. We have an incredible program at New Britain High School, that in our Healthcare Careers Academy. I see that in the future here too, of having our students from the high school, creating that pipeline of education and development, bringing our New Britain High students here to CCSU, knowing that they don't even have to leave town, although I'm sure some of them want to. They don't have to leave town to get the career, the nursing career that they're looking for, and to get the education that is going to bring them into a successful and fruitful career in healthcare. And for that, I'm incredibly proud. I'm thankful. I brought with me a couple friends today, Barbara Marino from the New Britain Board of Education and Jason Gibson from the City Council. Thank you guys, because our community support for this is imperative to its success. So I want to thank you all for inviting me to be here today to celebrate with you. Sorry for my last minute appearance. I was supposed to be on vacation. Well, hope we'll get there tomorrow. Thank you, everyone.
Thank you, Mayor, and enjoy that vacation. And now it's my pleasure to introduce our Provost, Dr. Kim Costellas.
Good morning. Thank you. Thank you all for being here to celebrate this exciting milestone for our campus, community, and beyond. Since January, the Central Community Health Education Clinic has served as a vital space for our students to translate classroom knowledge into real-world healthcare practice while making a difference in our community. This clinic embodies the essence of experiential learning, bridging the gap between theory and practice while fostering the next generation of compassionate healthcare professionals. Throughout the spring semester and into this summer, our nursing students have been running clinics each and every Wednesday morning, offering essential preventative healthcare services such as vision and hearing screenings, blood pressure, I think I need that screening right now, as well as glucose and cholesterol screenings. These services are not only accessible to the community, but also our faculty and staff. We are thrilled to continue offering them throughout this upcoming fall semester. In addition to weekly nursing clinics, our collaborative efforts extend across multiple programs, including exercise science, athletic training, psychological science, counseling, social work, and our nurse anesthesia practice. Together, students and faculty have conducted simulated patient experiences and hosted educational sessions on topics such as nutrition, cognitive health, mindfulness, and many more. These sessions are open to everyone, students, faculty, staff, and our community members, emphasizing our commitment to holistic health and wellness. Most recently, our exercise science students have introduced comprehensive health and fitness assessments available by appointment to both the public and our entire campus community. These assessments encompass various aspects of health, such as body composition, lifestyle and behavior, aerobic fitness, strength, and flexibility. The establishment and growth of this clinic would not be possible without the unwavering support and dedication of several individuals and departments. Sal and his facilities team truly transformed the space behind us that many of us did not think was possible, especially when we first walked in there and it looked nothing like it did today. And many thanks to George Claffey and Sean McNichol and the whole IT team for helping us get up and running, especially establishing our electronic health records. And as we navigate this new opportunity for our campus, we appreciate everyone's willingness to help us, and especially want to thank Stacy Votto for her legal guidance and Amy Lopez for working through new and unusual contracts. And it would be, we have immense gratitude is owed to also a small team behind us as well. Lisa McMahon, Kathy Bentley, Carrie Langevin, Salamar Rivera Santos, and Lydia Curtis, who day in and day out bring this clinic to life. They've transformed the vision into our clinic mission. And finally, and just as importantly, I would also like to extend our appreciation for those faculty advisory board members that President Toro alluded to as well. And I would ask for those who are here, if you could please stand to be acknowledged. Lisa McMahon, Clinical Coordinator and Faculty in PE and Human Performance. Kathy Bentley, Faculty in Criminology and Criminal Justice. Dr. Peter Morano, Athletic Training Faculty and Chair of PE and Human Performance. Dr. Carrie Langevin, Chair of Nursing. Dr. Andrea June, Gerontology Program Coordinator and Faculty in Psychological Sciences. Dr. Ronaldo Roja, Faculty in Social Work. And Dr. Arpita Lal, Faculty in Counselor Education and Family Therapy. Your passion, commitment, and vision has been instrumental, and we are deeply grateful for your tireless efforts on behalf of our students and the community. Looking ahead, we are excited to continue expanding our services, deepening the impact within New Britain and its surrounding communities, and involve even more academic departments in our clinic's mission. The clinic stands as a testament of the power of collaboration, learning, and serving, all of which are core values that guide us in everything we do. Together, we are building a healthier community. Thank you all once again for joining us today. We look forward to continued success of the Central Community Health Education Clinic and making a lasting difference in the lives that we serve. Thank you.
And now it's time to do the fun part, cut the ribbon. 3, 2, 1.
Three people. Do not do it.